Okay, this is going to be a continuation from my post that I did yesterday about recurrent back, hip, or knee pain. If you're experiencing any discomfort in your back, knees, or hips, and you do a lot of exercise, running, cycling, squats, deadlifts, then you're going to want to pay attention to this because there's some things that you must consider, okay? If you're in that one plane forward and back for too long, you're inevitably going to develop muscle imbalances, pain patterns, and weaknesses. This is going to set you back long-term in your training, and then at rest, or even worse during exercise, you're gonna have bouts of discomfort and pain. So what you're missing is when we're doing flexion and extension type exercises, you're only working in one plane of movement. But if you read and research the body, there's actually 3 planes of movement that we operate in. The first is forward and back, which is gonna be your sagittal plane. And then there's a side-to-side one, which is your coronal or frontal plane. And then there's a rotational component as well, and that's your transverse plane. We do movements in all these planes, so when we train, we need to keep that in mind. If you're just training in the sagittal plane and you're forward and back, you're gonna have IT band syndrome, or you're going to have bursitis at the hip, or you're gonna have chronic pinching low back pain. And that's because you're not honoring and doing exercises in the frontal plane or the transverse plane. So you need to bring in the rotational component in joints, and you need to bring in the side to side, the side shuffle components, the lateral abduction when you're working your glutes, for example, because if you don't, you're inevitably going to develop muscle imbalances and be stuck in pain. So if you haven't been presented this concept before, you definitely need to look it up. There are 3 planes in the body that we care about. You must train in all of them. You need the rotational component, you need the side to side component, because most people are getting enough of that forward back flexion extension sagittal component. And if you're having any pain patterns, you haven't been able to solve what's going on, shoot me a message, because I can look to see where your training's going wrong, where your connective tissue is breaking apart, and where we can apply some of the treatments I use like prolotherapy to actually fix your pain once and for all. When you combine the two, proper treatment and soft tissue work with the kind of training that your body needs, good things will happen and you will be moving without pain. So shoot me a message and we'll talk soon.